yesterday in the hospital. She's not feeling too good.
Oh really? When she get out of jail?
Well, the patient showing symptoms of shortness of breath,
Shortness of breath, you could have just said SOB, it would have been shorter.
SOB would have been used to describe Dr. House.
non-productive cough, and fever.
Okay, so non-productive cough, that cancels out the flu. And fever cancels out cold, so all we have left is bronchitis and pneumonia. So what do you think we should do?
Well, we should get a chest x-ray, right?
Yeah.
And I think a lung biopsy would be good, yeah.
And a blood test.
A blood test?
Yeah, don't worry about it. Just do what I say, okay?
Why would he want a blood test? Okay.
Your blood test said that you have HIV.
What's HIV?
HIV is an STD that then lowers your immune system, therefore explaining why you've been sick so often lately.
How do I get it?
From shared needles, from being promiscuous.
What's that?
It means sleeping around.
Tommy Lee, Bill Clinton, Bruce Willis.
Sorry, we don't need the details. We'll come back with the blood test. With the other tests.
Okay.
Dr. House, I took the lung biopsy of Paris Hilton, and as you can tell, I'm noticing a lot of inflammation in her alveolar cells, and it looks like throughout the whole lung that there's an equal distribution of this inflammation. I mean, obviously it must be some type of pneumonia. I mean, it's just evenly spread throughout the lung and all the alveoli.
The microscopic analysis shows cysts in the lungs that are spherical, thick wall, and are cup-like shaped when collapsed. The cysts are 5 to 7 micrometers in diameter, containing up to 8 spherocytes.
Interesting.
Dr. House, I have this chest x-ray for Paris Hilton up here on the screen. What do you think about it?
Well, there's a lot of inflammation in the lungs, so I think I pretty much have a good idea of what it is.
Okay, sounds good. Ladies and gentlemen, I have the best gift that you will ever want to give somebody. Have an old pod at home, just an old little bucket that you want to get rid of? Don't get rid of it. You can use it like we use it. We have the hot rod pod here. The hot rod pod is just no ordinary planting pot. There are no plants in this pot. No, it's perfect for traveling, for teachers carrying things. In our pod, we have markers. We have markers that you can write on. What else do we have in this hot rod pod? We have Dr. Pepper. Ah, so good. This pod is named after our fine creator, Hot Rod Pod Anderson, and he's been carrying it around for so many times that we decided to make go famous with it. So this pod can be yours for just a whopping price of $19.99. Get yours now. What do you think she has, Dr. House?
She has Pneumocystis pneumonia, an infection of the lungs caused by the fungal organism Pneumocystis jirovecii.
Oh.
What's the pathogenesis?
If I remember right about this type of pneumonia, it usually is inhaled through the respiratory routes in the lungs via droplets within the air. And then it attaches to the type 1 alveolar cells, which makes sense on why the alveolar cells in the lung biopsy were so inflamed and there was so much pink in that lung biopsy. It then develops when the immune system is weak and when CD4 cells, the white blood cells, are low. It then damages the tissue in the lungs when it starts to replicate and it fills the alveoli, thus leaving scar tissues, resulting in diffuse alveolitis, which impairs oxygenation. Which also makes sense, Dr. House, because in the chest x-ray, there's so much scar tissue going on, it took up the whole x-ray. How do you think Paris got this? What do you think the transmission was?
Well, this disease does not affect people that are healthy. It affects people with a failing immune system, such as people with HIV.
Oh, okay, that makes sense. Well, we should probably go tell Paris, shouldn't we, Dr. House?
Go do it.
Okay.
That king's hot.
Paris, you have Pneumocystis pneumonia.
Am I gonna die?
No, we caught it in time, so we could treat you with an antibiotic, a combination antibiotic, trimethoprim, sulfamethoxyl. It's a combination antibiotic that would help reduce and stop the growth of bacteria in your lungs. And you are to take it double-strength tablet 3 times a day for 21 days.
I don't know what that means, so I'm texting Nicole.
You probably should have your doctor explain it to you so they can help treat your HIV.
Can I get this again?
Well, since you have a weak immune system, then you could easily get it from people around you. So you need to be on a prophylactic dose of trimethoprim and sulfur methoxide, and to maintain a healthy immune system through exercise and like a well-balanced meal.
I dance 3 nights a week at the club.
You shouldn't stop smoking too, since you can maintain a healthy lung so that to prevent infections.
But I only smoke like 4 nights out of the week when I'm drinking.
You need to stop drinking too.
This HIV is totally ruining my life. I'm late for facial. Are we done yet?
Okay, that's much more important than what we're talking about now.
Hello, I'm a TV star.